Okay, audience. Okay. Hello everyone. So I'm sure many of you out there have heard of type 1, type 2 diabetes, but I will be discussing gestational diabetes with you and the tests and treatment used. So with gestational diabetes, this is during pregnancy, and what we're going to start off with is the 50-gram glucose, which is the start of it all. It starts by the provider, the doctor, ordering the 50-gram glucose in a patient who's either in the first trimester or between 24 to 28 weeks, which is when the hormones reach the highest of its peak. So this is when some of even the most healthiest women develop gestational diabetes. So these are the testing timeframes, and what's going to happen is the patient will come in, they will consume the 50-gram glucose, and an hour after, they will get their blood drawn. Now, what happens is, where I work at the Kaiser, with our department is called the Regional Perinatal Service Center, we download the abnormal data. So all the abnormal tests, they will come through our clinic, and we will be contacting the patients. So patients with what we call a routine 1 hour glucose, the 50 gram of 140 to 179, usually what happens is those patients, we have them complete a routine 3 hour glucose test. So they will go through a process of getting their fasting drawn and then consuming 100 grams of glucose drink. So it's the same small bottle, just sweeter. And then they draw their blood every hour for 3 hours. Now the 50-gram glucose with the 180 and higher, what happens is those are considered our stats. So for those patients, they are somewhat along the lines of the 3 hour routine, but they get their stat fasting done, meaning we're looking within half an hour to an hour for them to get the results back. So if their fasting blood sample is 94 and below, we'll have them stay there to complete the 3 hour test. So at that point, they get a glucose drink to drink, and then they draw their blood every hour for 3 hours. But if the fasting blood sample is 95 and higher, they'll stop the test and send them home. So what that means at that point is that there is gestational diabetes, and they'll get another call from us, usually within 48 to 72 hours, and how to proceed next. Now that we've gotten through the 1 hour glucose process and the 3 hour test process, I'm going to discuss the diagnosing stage. So the 3 hour glucose test as well, we download the result, and we look for 2 or more elevations. Doesn't matter the sequence and where those elevations are. So keep in mind there's a fasting and then the 1, 2nd, and 3rd hour after the glucose drink. Usually the fasting we're looking at 94 and below. The 1 hour after, we're looking at 179 milligrams per deciliter below. 2nd hour is 154 milligrams per deciliter below, and the 3rd hour is 139 milligrams per deciliter below. So as well as, like we mentioned before, the patients who have a 1 hour glucose of 180 and higher, and then the fasting of 95 and higher, those are also automatic diagnoses. Now those patients, what's going to happen is when they have gestational diabetes, we will be scheduling appointments. So we're going to have them see a nurse to show them how to use a glucometer. So it's a device, so it'll read where their blood sugars are. They measure 4 times a day. So usually their fasting's first thing in the morning, and 1 hour after the first bite of their breakfast, lunch, and dinner. And then as well, we're also going to schedule them an appointment to speak with a dietitian and going over the diet guidelines. So when a patient is testing for blood sugars, we send them this blood glucose monitoring logbook where they can write them down, as well as information that referring towards that diet plan of the 6 small basically it's 3 main meals and 3 to 4 snacks in between. So here's an idea of what it would look like. So that's a sample menu guide to help out the majority of the patients, and then there's diet tips as well. Now, I hope I didn't exhaust everyone, and I hope everyone now has a little slight hint of the process of the 50 gram, the 100 gram glucose test, and what happens once they diagnose it. Sorry, man, I know it may seem like I'm, keeping you guys out a little bit because you're like, oh, this happens to women, but hopefully, for you guys, with the future spouse or for everyone in the family, they can take this little information and hopefully guide them along in their new chapter of their lives. So, hope everyone got some good information out there. Well, take care, everyone.